Hi, I'm starting from. This is my informative speech. I'm now going to introduce my audience.
Sarah Hutchison. Sarah Hutchison.
Specialist King.
Sergeant Rodriguez.
Sergeant Wright.
Sergeant Church.
Okay. So, by a show of hands, how many of you have an immense fear of something? Everybody, go ahead and tell me what it is.
Heights. Being in the dark after you watch a scary movie. Big, intimidating people make me nervous.
Okay.
Spiders.
Spiders. What about you, Sandra?
Snakes and wild dogs.
Wild dogs.
Doctors.
Doctors.
At times myself.
Yourself. That's scary. Okay, my credibility is I have researched phobias inside and out. Throughout life, there have been ongoing studies and cases of various types of phobias. In an effort to help those who live in fear every day, there are three aspects of phobia. First aspect, we will talk about the medical assessment of phobias. The second aspect, we will list the common phobias in the world today. The last aspect, we will thoroughly discuss the treatments available for phobias. Now let us begin with the medical assessment of phobias. The first aspect we will talk about is the medical assessment of phobias. Phobia is defined as the unrelenting fear of a situation, activity, or thing that causes one to want to avoid it. There are three kinds of phobias, which are social, specific, and agoraphobia. Social phobia, fears involving other people or social situations such as eating in public, going to the bathroom around people, stuff like that. Generalized social phobia is an example of that would be social anxiety disorder. There are specific social phobias, which is an anxiety triggered due to specific situations. Specific phobias, fear of a single specific panic trigger such as spiders, snakes, dogs. Many people have these fears, but to a lesser degree, not considered an actual phobia. The people who suffer from specific phobias specifically avoid the entity they fear. Agoraphobia. Generalized fear of leaving home or a small, familiar, safe area. It is likely that panic attacks will follow. May be caused by specific phobias such as fear of open spaces, social embarrassment, fear of contamination, or PTSD, post-traumatic stress disorder. Phobias vary in severity among individuals. The effects of phobia, if left untreated, can worsen by either the phobia itself or the attempt to try to hide it. Causes and risk factors of phobia. There is no specific known cause, however, it is believed that phobias run in families are influenced by culture and can be triggered by true life events. Symptoms of phobia. Most symptoms consist of panic attacks. Phobias are assessed by licensed mental health therapists, family physicians, and other medical providers such as psychiatrists, psychologists, and social workers, which give their diagnosis. People cope with phobias by talking to others about their fears, avoiding stressful situations, visualizing overcoming their fears. Now that you know the medical aspects of phobia, let's name some common phobias. The second aspect we will list from A to Z are the common phobias in the world today. So here's my visual representation. Phobias by Sergeant Chastity Crone. The first one, ablutophobia, fear of bathing, washing, or cleaning. Acrophobia, fear of heights. Agoraphobia, fear of places or events where escape is impossible, where help is unavailable. Acmephobia, fear of sharp or pointed objects. Elorophobia, fear of cats. Algophobia, fear of pain. Agiophobia, fear of crossing roads. Androphobia, fear of men. Anthrophobia, fear of flowers. Apophobia, fear of bees. Aquaphobia, fear of water. Arachnophobia, fear of spiders. Astrophobia, fear of thunder, lightning, and storms. Aviophobia, fear of flying. Bathmophobia, fear of stairs and or steep slopes. Bibliophobia, fear of books. Biphobia, fear of bisexuals. Botanophobia, fear of plants. Cacophobia, fear of ugliness. Chemophobia, against artificial substances in favor of natural substances. Genophobia, fear of snow. Chorophobia, fear of dancing. Chirotophobia, fear of bats. Claustrophobia, fear of confined spaces. Calorophobia, fear of clowns. Cynophobia, fear of dogs. Decidophobia, fear of making decisions. Dentophobia, fear of dentists or dental procedures. Entophobia, fear of insects. Epiphobia, fear of youth. Equiphobia, fear of horses. Ergophobia, fear of working and or functioning. Gelatophobia, fear of being laughed at. Gephyrophobia, fear of bridges. Sclerophobia, fear of growing old and or aging. Glossophobia, fear of public and speaking in public. Gynophobia, fear of women. Heliophobia, fear of sunlight. Herpetophobia, fear of reptiles. Heterophobia, fear of heterosexuals. Homophobia, fear of homosexuals. Hoplophobia, fear of weapons, special firearms. Ectophobia, fear of fish. Pyrophobia, fear of fire. Radiophobia, fear of x-rays. Scolophobia, fear of worms. Scopophobia, fear of being looked at and or stared at. Sociophobia, fear of social situations. Somnophobia, fear of sleep. Technophobia, fear of graves and or being buried alive in a grave. Technophobia, fear of technology. Tocophobia, fear of childbirth. Tomophobia, fear of surgeries and or having a surgical procedure. Transphobia, fear of transgender or transsexuals. Traumatophobia, fear of having an injury. Trypanophobia, fear of needles and or getting an injection. Xenophobia, fear of strangers, foreigners and or aliens. Zoophobia, fear of animals, which is a generic term. The second aspect, now that we have thoroughly discussed the different types of common phobias, now let's talk about the variety of treatments available. The last aspect we will thoroughly discuss are the treatments available. Systematic desensitization therapy. Its goal is to overcome this avoidance pattern by gradually exposing patients to the phobic object until it can be tolerated. Cognitive behavioral therapy, CBT. Eye movement desensitization and reprocessing, also known as EMDR. Hypnotherapy. Antidepressants. Emotional freedom technique. For phobias, we have covered their medical assessment, the list of common phobias, and treatments. There are three aspects to phobias. First, I covered the definition of phobia. Second, I listed the common specific phobias. Third, I thoroughly discussed the treatments. And let me just leave you with this final thought. The next time you get immensely scared by something, ask yourself, is it a phobia or just the EBGBs?